just to provide some context, before this year and these bills were passed, our state in Washington did not have a statewide standard around use of force. So depending on whatever jurisdiction you were in, you could be treated differently by police in terms of physical force. And it was very inconsistent across the state. And we had, varying outcomes for community depending on force and depending on where they were located. So over the past year, we've worked with community members, families impacted by police violence in our state in law enforcement to codify into the law a statewide uniform standard around use of force, which also included a reasonable duty of care for officers. And really the baseline for that is to make sure that there's de-escalation and less lethal enforcement of the law, and hopefully to protect and preserve community members from any excessive force. So House Bill 1310 established that baseline standard. It took into consideration, context, the totality of the circumstances. So, an officer must first, evaluate if someone is, for example, experiencing a mental health crisis, if there is a child involved, if someone's pregnant, if, all these different things that are important to take into context before using any force. And then when available and when appropriate, they have to use de-escalation first prior to using force. So tactical questioning, repositioning, creating time, distance, and space between themselves and the person, and evaluating if there's an imminent threat or likelihood of imminent threat in that situation before using force. And then after doing all of that, if it's determined that physical force is necessary in that incident, then officers can use the least degree of physical force. And we provided a number of options: less lethal ammunition, beanbag rounds, rubber bullets, trying to use different tactics that are not lethal. And then if deadly force or lethal force is necessary, that's the last resort. So that's what we did in 1310. And then House Bill 1054 established what tactics were necessary for police and removed certain tactics from police and their protocols. So, for example, we removed chokeholds and neck restraints or lateral vascular neck restraints. We removed the no-knock warrant as a tool to use based on data and evidence that produce negative outcomes for communities of color. And the no-knock warrants have been largely removed across the country because they were rooted in the war on drugs. So a lot of times in the 80s and 90s, they were used to knock down doors and enter a household where there was reasonable suspicion to believe there was illegal drugs. So, we moved a lot past that since then. And so in 2021, we wanted to remove some of those policies that are rooted in that historical racism. And so that was one of the things we did with that. We also banned certain military equipment, MRAPs, high-powered machine guns, rifles, things that we thought were unnecessary for police. And then we restricted certain things. We restricted tear gas. We restricted canines and when they should be apprehending suspects. And we restricted vehicular pursuits and high-speed car chases. And then the final thing we did in 1054 was ban or prohibit concealment of badge numbers, because we found that a lot of times in some of the protests or demonstrations last summer, cops would enter, the situation and have, SWAT gear on, but did not have a visible badge number. So you couldn't tell, if something happened, you couldn't report the officer because you didn't know what their number was, their name, or anything. So that's something we prohibited as well. So all of that together hopefully address some of the accountability that we were looking to do. And of course, we had 12 total bills. We had a lot of bills, but those were the two that I sponsored. We historically, in our state at least, I'm not sure for other states, but in our state, law enforcement tries to reform itself from within. So they would, present a policy or a bill or a piece of legislation to the legislature themselves. And this year we decided to take an entirely different approach. They still presented, their own versions of what they thought should change, but we put that to the side and we said, we want community to be the drivers of this change. So we worked with a group called the Washington Coalition on Police Accountability, which is 25 people that were selected by the governor's office to work on police accountability work. And so that's families impacted by police violence. The majority, I would say probably at least 75%, had lost a child to police or at the hands of police in our state. We also have lawyers, legal folks on that team, folks from the faith-based community, predominantly communities of color because of the disproportionality of who's impacted by police violence. And we worked with that group the entire way for about a year. Actually, we started in July of 2020. I remember that because it was literally a few weeks after George Floyd. And we worked all the way until, passing the bills in May of 2021. And we're still working with them because we've got a lot of pushback from law enforcement on the bills. And so we're still working with them right now on implementation. But we worked for an entire year. We listened to them. We had, we were in the middle of a pandemic, so we had virtual meetings on Zoom, hearing their stories, their lived experience. And then I think a couple months into the process, we brought in law enforcement at the same table as the coalition. And those were some very challenging conversations, as you can imagine, differing opinions. But we, hashed it all out, and we came to, these bills. And even throughout the session, we still had amendments on the bills. We only got one Republican vote in the Senate side, one in the House. So, this was predominantly across party lines, and so that was unfortunate. But I think at the end of the day, that's why you fight to have the majority in the state. And that's what got the bills passed, by having that majority. And, honestly, I think without the George Floyd incident, even with the police killings in our state of Manny Ellis and Stonechild Chief Stick, there's a lot of different examples of individuals unarmed that were killed by police. With George Floyd, that was just different because it was on video. And so I don't think without George Floyd and without that video, any of this would have been possible. And I don't think we would have had the momentum to get them passed. But because of that, we were able to get it passed because we had a lot of community support behind reform. One of the things that, if anyone is going to work on this stuff, these are big policies and there's always going to be tweaks. And I always say, once a policy is passed, it doesn't mean it's the end of it. And so right now we're working on a couple trailer bills that will clarify legislative intent, because we've had a huge problem since the bills went into effect July 25th, where police are simply saying, we're just not going to show up. A lot of it is they're just angry at the bills, but there's been an uptick in not responding to calls. And so the Attorney General, the governor's office are working on, can departments be held liable for just not responding? And while they're doing that, we're looking at clarifying some of our language to make it clear that officers must still do their jobs. They still have to respond. It's just about what they do once they get there. And so, that work is happening right now. And a lot of that is in relation to mental health calls, which we'll talk about. But police, in our state at least, we have a co-responder model. So, designated crisis responders show up with law enforcement when there's a mental health call from the 911 dispatcher. And but the mental health professionals need an officer to enter any incident where a weapon may be there or it's an imminent likelihood of danger type situation. And when an officer is just saying, well, I'm not going to go in because our lawyers are telling us the liability is too much, is greater than us not going in, then the mental health folks can't go in. So we've had a number of incidents where, both are just not entering the home or wherever the case is at. And then, that individual may go out and actually commit a crime because they weren't getting the services that they needed. So we're having to work through all of that right now. And that takes, collaboration with police. We're working with police on language that's going to meet their needs, but also still not get to excessive physical force, which is what we don't want. So just wanted to say that that's definitely something we're working through. I really think it's worthwhile in that, we want a continuum of procedure with mental health. So, like I was saying, when police show up, they're kind of looking to go to the last resort, which is involuntary commitment, literally, taking someone by the arm and saying, you are going to the hospital. But of course, before that happening, hopefully there's a different dispatch unit that gets called, and police only have to show up if it's, a crisis where you need someone with a gun. And then, hopefully there's treatment, hopefully there's, outpatient, not inpatient services provided. And hopefully there's a lot more de-escalation prior to someone coming in with the mentality of, we need to get this person out of the vicinity and into a hospital. So I'm hoping, like, that's just my thought, that is part of it. And I think that's part of the conversation, is what that looks like. And like I was saying, we're finding that different jurisdictions want to do different things. Like, there's already some cities that really want to transition to that right now. And there's others that are very hesitant based on their community. And, I think from our job at the state level is to provide the guardrails for local jurisdictions to go through. Just like education, policing is localized. So like I was saying, Seattle defunded their police. Well, the city I live in, which is about 30 minutes south of Seattle, just increased police funding by a ton. They added 25 officers in the last couple months because of increased crime. So cities are doing entirely different things right now. And so our job isn't really to put these mandates on the local governments, but to say, here's an option. Here is a grant program to support that option. And here are the guardrails for doing that procedure. And so I'm hoping with this system, we'll give local jurisdictions to make that decision, but it's not going to be up to us to say you have to use it. One thing I've learned in this process right now, I'm kind of a polarizing figure in my own community. With the work that I did on, as you can imagine, I live in a semi-swing district, semi-conservative. It's about 50-50 Republican, Democrat. And, I'm definitely very vulnerable because of the bills that I pass. However, being one of very few African-American legislators, I felt the urge and the ask from community to work on it last year. And I think, we're going to have to figure out, as we're putting accountability in for police and as we're creating these new systems, how do we also hold everyone accountable, the community accountable? And I think that's the conversation we need to have. Are we also working on, the big increase in gun violence in our community? Are we working on, like you said, suicide prevention, all these things alongside putting accountability measures in place for police and creating new systems? And I think it has to happen simultaneously. And when if you put the cart before the horse, you better have a backup plan if it doesn't work out. And so I think, taking our time, going slow to go fast with this 988 system is more important than hurrying up and getting it in place. We need to get it right. One of the major things that happened last year in our state was the state Supreme Court passed something called the Blake decision, where they decriminalized drug paraphernalia. And so essentially, if you get caught with an illegal drug, they made it so it's not a felony or a misdemeanor. It's, nothing. And then we as the legislature had to go back and say, well, because before it was a felony, it's just a gross misdemeanor now. And we're going to have to revisit that in 2023 because it has a sunset on that bill. But decriminalizing illegal drugs was very controversial, and a lot of the state did not like it because they thought it was the legislating by the bench. The courts decided it, and so the legislature had to come back and fix it. But other people were upset that we recriminalized drug paraphernalia by making it a gross demeanor when the court said it shouldn't be a crime to have an illegal drug. So that's just an example of, we really need to work on these things before we make major decisions, and it has to make a lot of sense. It has to involve a lot of stakeholders and a lot of folks you don't want to hear sometimes, which is always a challenge to work through that. But that's kind of the learning lesson for any policy. I always tell myself, am I getting tired of the work or in the work? And if I'm just tired in the work, that's fine. That's kind of normal. You're just, you're having a lot of meetings, you're dealing with emotionally charged issues. But once you get tired of the work and you don't have a motivation to do it anymore, I think that's when you probably need to leave. And luckily for me, I still wake up very excited about the work because we have to be honest about the world around us. And when I look at what's happening to folks, not even just folks that look like me, but folks from lower socioeconomic backgrounds, the undocumented community in our state, we have a lot of work left to do to make it a more just place to live. And so, you know, I think there's a lot more work. So I wake up and I'm just energized about the work. But, you know, hopefully that stays and hopefully I don't get tired of it.